Hello, I'm Dr. Diane Vickery. The video that you're about to see will show you a patient's experience of cataract surgery at the Pacific Eye Centre.
We aim to provide the most efficient and innovative cataract surgical techniques and anaesthesia, whilst making our patients' visit to us comfortable, safe and with a minimum disturbance to their everyday routine.
All the cataract surgery will be performed at the Pacific Eye Centre by a team of experienced cataract surgeons.
Our practice philosophy is that our highest duty is to treat patients entrusted to our care as we would wish to be treated. We believe in the principles of caring, kindness and compassion and strive to incorporate these in our patient care.
We believe patients and their families should have access to honest and forthright medical information presented in a manner they can understand. We believe that patients' families and friends provide support, and we would encourage them to be as involved as possible in our care of their loved ones.
We believe all our actions should be guided by integrity, honesty and courage.
Pacific Eye Centre provides a specific line of service for those patients suffering from cataract. This is called the Cataract line of service.
We've identified our service in this way so that we can provide a continuously improving service to restore sight to those patients suffering from cataract and improve their quality of life.
All the cataract surgery will be performed at the Pacific Eye Centre by a team of experienced cataract surgeons.
John has noticed progressive difficulty with his vision over the last few months. He has been found to have a cataract by his doctor, and this is causing his reduced vision.
He has been referred to the Pacific Eye Centre for surgery. We will now watch John's experience of his cataract surgery. Firstly, he arrives and checks in with Cindy, our patient care coordinator.
He is then taken in to see Kerry, our anaesthetic sister, and drops are instilled to dilate his eyes. He is then seen by Jim, our anaesthetist, for his examination pre-operatively.
He is to be given anaesthetic drops and a tablet to take to make him feel relaxed and comfortable prior to surgery.
Now he is taken in for his surgery.
Yes, very nice and
His family are able to watch his operation from our observation room, and the operation is described to them by our staff member. Following his surgery, he is then taken out to relax in a comfortable chair, surrounded by his family or companion who has observed the surgery. Now I spend some time with John, telling him the do's and don'ts following his surgery. He is then given more detailed instructions by Kathy, our patient care nurse, and then given something to eat and drink. He is now ready to go home, relax, and come back and see us tomorrow for his post-operative visit. The next segment of our program is very special because it is your surgery. All our surgeries are videotaped and the procedure is explained so that we can provide an informative account of your surgery so that you, your family and your friends can all have a better insight into the process. So now, let's watch your surgery.
Yeah. So what I'm going to say is going to be recorded. So we've just seen the first two incisions. The first one was a vertical one, followed by a horizontal, and this is the third. And it penetrates into the anterior chamber, enlarges the first two incisions, and releases the natural fluids in the eye. The natural fluids are now replaced with a viscoelastic, which is a jelly-like substance. And the surgeon's going to put a small port into the left-hand side here, and that will be used during the operation for a second instrument to help rotate the cataract.
Right.
So that's a little further down the track. We're looking at the 65 times magnification, and the surgeon here's got picking up on the top of the capsular bag, and this is a membrane that surrounds the entire cataract.
Right.
So by removing this little section here, circular section, which is, by the way, the most difficult part of the entire operation, it's gone really beautifully. A fluid wave is pumped now between the actual cataract and the capsular bag, because the surgeon now has access to the actual cataract. So that is now floating in that bag and in that fluid, so it can be manipulated and fed towards this gold-tipped instrument that's coming in here now. This vibrates at 45,000 times per second. And emulsifies the tissue and sucks it up. And it's the technique is called Phaco chop, which can break up even the most densest cataract very, very quickly to remove and break it up. So you can see how the tissue is very opaque and yellow. Well, that's as the light hits it, it very much distorts the message received at the back of the eye, and therefore by replacing this cataract, the cloudy cataract, with a clear lens, the correct image is received at the back of the eye and taken to the brain. So, and here very, very quickly, using this Phaco chop technique, which is a minimal amount of time in the eye, which minimises the risks and complications, the surgeon's now simply up to changing hand pieces. Of course, the structure of the eye is very similar to that of an onion. What she's doing now is peeling the outer leaf of the cataract from the inside of the capsular bag. Again, it's irrigating through the base of the stem, and then at the very tip it's aspirating and sucking up the tissue there, the cortex.
I noticed that in the last time, how clear it was first, and then how they, after the lens was put in, was the sucking of the air bubbles out of it to prepare it for its self-sealing.
Yes. So here we have a lovely red reflex. The viscoelastic's been introduced again. Expands the capsular bag and the anterior chamber, and it's ready to facilitate the interocular lens. The lens is being injected in through a 2.8mm shooter, and there it is.
This particular one is a factor of about 3 as compared to 6 for the other eye. I'm sure when they tested it down at Baxter Street. Is there any reason for that?
Every eye is different.
Oh, yeah.
And every bit of lens, the distance from there to there is, everything's a little bit, everybody's unique. She's sealing up the self-sealing incision, she's removed the viscoelastic, she's making sure the anterior chamber is well inflated, the lens is beautifully centred, testing for water tightness, and there we have a beautiful sutureless cataract extraction and interocular lens implant.